Hello, everyone. Welcome to today's webinar, hosted by the American Public Human Services Association, or APHSA, in partnership with EY. Today's webinar topic is Summer EBT Success, Unveiling the Sunbox Program's Nationwide Impact and Best Practices. Next slide, please. My name is Alex Claremont, and I'm the Senior Content Writer here at APHSA. I'd like to take a moment to share with everyone an overview of APHSA and the work we do with and for our partners and members. APHSA is a membership organization that represents state and local human services agencies from across the country through their top-level leadership. We're a bipartisan organization focused on building common ground. Next slide. We aim to deliver for our members through three core channels: influencing modern policies and practices with the goal of strengthening communities, building capacity through our conferences, technical expertise, publications, and technical assistance and training consulting practice. We also focus on connecting members with key partners. Next slide. Speaking of connecting members, I invite each of you to save the date for next year's series of APHSA conferences. Our National Human Services Summit will be held from June 1st to June 4th in Philadelphia. Also keep an eye out for our Economic Mobility and Wellbeing Conference happening in August in Minneapolis. In September, between the 14th and the 17th, we'll be hosting the ISM convention in Reno. And October will be the month for both our NSDTA and PHSA education conferences. Check our newly relaunched website at aphsa.org for updates on all these conferences. Now, before we begin, I'd like to go over some light housekeeping. During the presentations, we're requesting that you put your questions for our presenters in the Q&A panel rather than typical Zoom chat feature. If possible, presenters will try to answer questions during the presentation, but there should be also time left at the end for questions. This webinar is being recorded, and it will be shared with all registrants in the coming days. Next slide. Now, it's my pleasure to introduce the moderator for our panel discussion, Greg McKay, Health and Human Services Government Executive Leader at EY.
Thank you, Alex. Well, welcome, everybody, and thank you for joining today. I'm so happy to be a part of this. I'm brand new here at EY. I'm here about 4 weeks now, and was so glad to get the invitation to take part in this, which is kind of dear to my heart in certain ways as well. So I won't waste time with introductions on me. You can read about me in the bio, I'm sure you saw as part of the introduction to this. But mainly, I led a child welfare system in the state of Arizona for several years and saw all of the impacts that can result in system involvement. So I think this is a great topic to discuss today and see how confronting food scarcity issues and having special programs could really mitigate some of the consequences to parallel systems where we all live and work and have communities. So I also saw some old friends in the list of people who signed up. So if you are out there, I'm saying hello to you now, and you know who you are, and please say hello to me sometime. But so with us here today is Leah Yarbrough and Cynthia Urban. And I'm not going to recite their bios and make that boring. I'm going to let them tell you a little bit about themselves and why they're involved in this particular program. So first, I'll start with you, Lee. Just tell us a little bit about who you are, what you do, and why you were part of this, and how EY contributes to things like this with government. Lee?
Thank you. I appreciate that. Yes, thank you. Leah Yarbrough. I'm a manager with Ernst Young's government and public consulting practice and working with state and local governments. Formerly a state employee myself in Florida, I specialize in public assistance programs and managing large-scale complex projects and transformations. I've had the distinct pleasure of working with Cynthia and DHHS in the state of North Carolina in support of pandemic EBT and summer EBT. And I'm glad to be here today. Thank you for having me.
Great job. Yeah, as somebody new to EY that spent almost my whole career in government, about 28 years, and now I'm with EY, and people say, well, what is EY doing with government? And so this is a great example for you guys to kind of talk about that. And that'll help make it easier for me to answer in the future. So great. So Cynthia, over to you. Why don't you tell us about you and also So glad to see you're here representing North Carolina. I think the whole nation was gripped and saddened by the impacts of hurricanes, and my gosh, just watching some of the footage was just heartbreaking. So glad to see you. Glad to hear you guys are continuing to work for children and families there. So over to you.
Thank you, Greg, and thank you, Leah. And again, yes, thank you for your sentiments for our victims here in North Carolina. And yes, this is just a litany of things that we do in DHHS to make sure we address children and families wherever their needs are. But I wanted to kind of give a background really quickly of how I've come to this space today. So I have had many years of food and nutrition management with Aramark Services, many years, and then I left and I started with the state government. And it's interesting, I started with DHHS in the summer nutrition space where we were providing meals to children, left DHHS, went to DPI, which is our educational component, really was planning on taking on a new kind of role there, moving away from the summer nutrition space. And somehow the summer nutrition followed me over to DPI. And so one of the things that I noticed there was that summer nutrition programs really focus on the child or the children, and realized quickly that hunger is a systemic issue. It's not just something that affects children, it affects the entire family. So I then decided that I wanted to come over to the SNAP program where we were kind of addressing the entire family. And would you know, I happen to take on SumBucks now, summer nutrition again. So I think it's part of my DNA, but definitely happy to be here today.
Great. So do you want to give us a little, just kind of set the table with what the why behind the program there in North Carolina? And I know it wasn't easy. I mean, hearing some of the things I learned about the program, it wasn't just like you had a bunch of money and picked a project to go off and do. This was hard and really required a lot of work and a lot of creativity, as I understand it. So why don't you just tell us, what made North Carolina pursue this, how you kind of launched it. Just give us a little bit of background around it.
I surely will. And you're right, Greg, it is not an easy program, but again, anything that's easy is not necessarily worth it. So we found this to be definitely a worthwhile endeavor. But I wanted to start with our history. So back in 2020, in the COVID-19 days, North Carolina was one of the early adopters of the PEBT, or the pandemic EBT. So even back in 2020, DHHS led that process of the pandemic EBT in partnership with the Department of Public Instruction. So we, through those years from 2020 to 2023, we ran every iteration of PEBT. So this will be PEBT in schools, PEBT during the summertime, childcare. We provided benefits to the childcare component. And then the final one, we were involved with the virtual and homeschool. And the virtual and homeschool part of the PEBT was very much in line with summer EBT. So we've learned a lot around PEBT and the need for the benefits, closing the gap during the summer when school is closed, when they lose all those benefits. And so with that, we really took a really close look at what would we not serve, who would we not serve, and how much of a gap would we leave if we did not do this program. And so you'll see a little bit later on, all the different metrics that we looked at, but it was significant. We had nearly, at that moment, we had projected at least 1 million children that we would not be able to serve by not having the program. Also, because of that, it also helped us to really focus on the hard work to get this going, because we knew in the end the outcome would be great. So we knew that it was not only going to be filling the nutrition gap, it was going to fill an economic gap. It was going to figure like an outcome for children that would go even further. Being a summer nutrition manager, one of the things I did know is that we always struggled to fill the gap of hunger during the summer with the summer nutrition programs. And so this was another kind of key motivator to continue to operate this program so we could close that gap of hunger. And again, I can say that PEBT in the virtual and homeschool world that required an application process was probably a key alignment with the summer EBT.
Yeah, you said a few things there that reminded me of some old days, and some of those were, you know, in the child protection or child welfare systems, summertime brings like this great lull for them. So when you know, anybody who's worked child welfare knows that you just run and run and run and run and run without a break, it seems. And then the summer hits and you just can breathe a little. But the reason for that is really because kids are out of sight. You know, they're not being seen in schools, and there's less reports, obviously, because mandated reporters aren't having a watchful eye on kids that are at risk or really in need. So, and a lot of that obviously is coming back to school and then responding. So when school returned to session, there was this massive report volume that came in that everyone scrambled towards. So I can't help but think that, you know, working on this proactively before that would really be helpful in so many ways. You know, how about, you know, so many things spun out of COVID in terms of new ways to do things and advancements. And, you know, maybe to bring Leah into the conversation, what was it that needed to be done for North Carolina to really be able to understand, you know, how someone's made eligible, how the benefits get to them, how you communicate the message? You know, so it's maybe a part of the question is for Leah and part is for you. So you want to start, Leah, with how you got brought in to support Cynthia in this project?
Sure, happy to. As I mentioned in the introduction, I'd helped North Carolina through pretty much the entire pandemic EBT program. So, and there are similarities between the two programs. There's, you know, really similar partnerships between state agencies, similar, you know, stakeholder groups that are involved, but there are differences as well. And when including with funding, and when the program was announced, the policy was shortly on its heels, and so there was a lot to do, even just to understand what the changes were, what might need to happen, kind of assessing the state's readiness from a funding perspective to what needed to happen there, to what would the system changes need to be, what were the eligibility rules, how did it differ from the program, and what did we need to communicate, what were the populations that could be served, and just to really like we did, you know, in the early days with pandemic EBT, and kind of with each iteration of it, we started with, okay, what is the federal guidance for this program, and then we looked at what could be leveraged from the PEBT program, and then pretty quickly tried to assess what would need to be changed. There was not a whole lot of time to get it done. And so that was one of the things that we partnered, you know, really quickly with Cynthia and DHHS and DPI as well, just to kind of wrap their arms around what needed to be done, and to get it all planned out, start making some of those connections, and really to even work on some of those estimates, volume estimates, cost estimates, things like that, in order to really set the state up. North Carolina took a really novel approach to funding as well, which I think Cynthia will talk about a little bit later too. We really did have to get creative in some respects. And then, obviously coming out of pandemic EBT with the new program, there were enough similarities that we also wanted to look at lessons learned from that previous program and how we could continue what was working well, and adjust for the new program and come up with new ways of doing things that would perhaps be even better in this new program.
Yeah, so you mentioned a few things that trigger me, and Cynthia, I think you could answer this well. When it just comes to capacity of these organizations to do something more in addition to is just so tough. And, so from a point of, Leah mentioned, readiness and kind of feasibility to take on the program. And you have a certain amount of, capacity within your organization to do it. Cynthia, what did you need in that sense to get the organization ready to move forward and do this? I mean, how much of this involved, extra manual work, like more work that was kind of untenable already? And then, how did you work with Leah to make this, work in terms of, building capacity in terms in delivering the program? Because I mean, you talked about a lot of things like, how eligibility rules and the policies and Fed guidance and everything else. So there's a lot there to do. So how about a little bit on that, Cynthia?
Yes, and that is all correct. So when we learned of this program, we did have to take an internal look first to see what capacity we have. So because we have been using EY through the pandemic for a like program, and we did not have any infrastructure. We did not have any staff at all to do the summer EBT. We would have had to absorb it into our normal processes. And many of you who are other SNAP directors and maybe educational directors, that we are bare bone in staff. And so to take on a new project, especially one with this amount of lift, it just was not, we just could not absorb that in our standard. But again, I think our history with PEBT and working with EY actually helped us to determine. So our leadership was 100% on board with it. And that was the first thing that they said. Let's continue this process with EY. Since it's similar to PEBT, let's get them involved. They did a really good job of helping us to navigate the whole PEBT through all the iterations, that it was a no-brainer. We needed to continue this process because they were able. So because this program was just such a quick implementation program, it took a heck of a lot of work to try to understand the rules, understand the difference between PEBT and then SEBT. Not only did EY do that and help to train us and other stakeholders, we had to train leadership on what the difference was. And we had to train our own staff. And it just wasn't enough time for everyone to individually do it. So they really were very instrumental about bringing those kind of checklists together so that we all can kind of stay on a good continuum and make sure we were meeting all our requirements. Also kind of spearheading meetings with USDA to get question and answers so that we were clear on what our next roles were. But I definitely would say one of the major processes was just being kind of that glue between all of the key stakeholders, making sure we all kind of stayed on pace in order to be timely. But yes, we knew we did not have the capacity.
Well, I'll say so. You had no staff for a program.
None.
So yeah, it is funny. I mean, as you speak, I get triggered from the past, some of these things, but it's if I a lot of people on this webinar obviously wondering, if they're to do a program like this, what it takes, but also, what were the challenges? A lot of time, I think we learn most by people or organizations that wear the scars from doing bold things. So, maybe talk a little bit about, not so much pitfalls, but just challenges you had to overcome to make the program a success.
Of course, we've already talked about how quickly the program had to be implemented. Once we got the guidance in December, and then, we had to start moving forward, getting our plan of operations moving forward. All of that was quite the challenge, but also just understanding those key differences from PEBT, one of which is probably top of mind of many people that are on this call is funding. So we know that in PEBT world, it was 100% federally funded. Summer EBT is now a federal and state share. And so budgets had already been established throughout the state. Our state biannual budget had already been established. So we had to quickly work with our leadership. And again, I have to really highlight that our leadership was 100% on board from the announcement going forward. The governor was 100% on board, but we just had not presented this to our General Assembly for it to be considered for the budget. So since we had not done that, the first year all of the funds came from governor's funds and also some funds we found within DHHS, but we literally had to do fundraising. So a significant part of our funding came from philanthropy monies. And so I guess one of the things I would say is knowing your funding up front would be one of the things that I would suggest making sure you have in place. Or if you haven't so far, then I would suggest making sure that you get your philanthropy fundraising tasks on the way. As I mentioned earlier, another one that stood out is that we had staffing capacity. So and then even once we got the program up and going, still we don't have permanent employees assigned to this program. We are using temporary staff. And so that's one of the reasons why we have to keep outsourcing. But even past that, I think there's always a need to have some outsourcing, and especially when it comes to like the call center part of it. So our EBT vendor scheduling, that was a challenge. It was new to them, new to us. And so there was many processes that had to be put into place. And, in our original conversation, they were saying, you need to tell us, your issuance schedule, all of your estimates, and, for the whole summer, you need to give it to us 8 to 12 weeks prior to the first issuance. And that was very difficult for us to do, even having our PEBT data. Again, PEBT was very similar, but it was a lot different. And I'm going to bring up the major difference of what we had to work around is that in the summer EBT, we were not able to provide benefits to all the children in the CEP or the community eligibility provision schools. So we had to really determine how are we going to get this population? How do we communicate with this population? And how do we change their mindset from automatically getting a benefit for the last 3 years to now letting them know that they had to apply? So we also We also had to change the mindset of the educational community, who had to do a lot of work to make sure we were giving benefits to the right kids for the right reasons doing the PEBT. So we had to work with them and really motivate them that this is a new program. It's a much less lift of what you had in the PEBT world. So I guess I could say communication, it was kind of one of those key things that we had to learn how to do well. But I think Leah has a few more points that I want to kick it over to her.
Yep.
Sure, thank you, Cynthia. I would definitely say you mentioned timeline. There was a lot to do in a short time. The challenge was it involved a lot of different groups, right? And some groups were commonly engaged and kind of a core group, and some were a little more removed from the program. So one of the things, like you mentioned, in terms of communications, well, and to be really honest, folks were also tired. I mean, they had given it their all through the pandemic. Flexibilities for other programs were starting to unwind. We had to not only inform on what the differences were, but really to get people energized around standing up a whole nother program all over again, right? So that we really embarked upon a campaign to not just promote the program, the changes, and really individualize the way communications were made to each of those groups, which was really important, and even direct to consumer communications as well as kind of those core, partner groups and stakeholder groups that you mentioned. But those, the individualized outreach there, and just really helping people to realize what the importance of this program, why, like you were saying earlier, Greg, what's the big why, the rally around that. So they could get energized to do this all over again. And then also just really being really mindful of planning everything out, and staying really, really in touch with the core group. Frequent touch points, making sure everything, this is the project manager and me talking now, but really making sure that everyone was aligned, and moving, along the course as it needed to. There were a lot of things that needed to come together at once.
Great. So I got a question from the audience, kind of a more of a tactical question. So somebody out there clearly is wanting to know how it works more directly. So Cynthia, the question is about how do you obtain the child's most current address to be able to be involved in this. So do you have an answer for that person in the audience?
I think I do. Actually, this would have been considered one of our challenges too. So our data, so let me just kind of explain North Carolina. North Carolina, in DHHS, in our eligibility system, we have data from the SNAP program, from Medicaid, and we also have it from Work First. In the DPI world, we get data from the schools and those kids that are eligible for free or reduced price school meals. So after we really did a lot of investigation and using our kind of our history with PEBT, we determined that the better quality addresses were really in our eligibility system. And so we asked at the school level too, we gave them a date, I think it was around March, the end of March, that we did a whole campaign to families and to schools and all of their stakeholders to make sure that parents knew to update their address in their schools by that March date so that they could be in the April file. So we could have the best date addresses in the April file. But we also had a caveat that we advertised that if you're on one of those federal mean tested programs that we talked about, then if we were on one of those, then we were going to send it directly to that address unless they gave us more information of doing something differently. So pretty much generally, if they was on a federal means tested program, it went to that address. Otherwise, we used the school address, and it should have been the most updated that came over in the April file. I would say we did something slightly different for the foster care students because they are moved kind of frequently. We sent all of the foster care students' benefits to the child welfare contact at the county level. And we advertise that if you are interested, if you are a foster care student, you should reach out to your foster care, but your child welfare consultant. But we also train the child welfare staff how to manage those, make sure they get them to the student as soon as they have it. Homeless, if they were considered homeless, that also went to the county, and we told them to pick it up at the county. So I can't say it's perfect, but I can say that that did help us to make sure that we were all on the same page when it came to where we will be sending benefits.
Perfect.
And just to add to that a little bit as well, that was perfectly said, but you heard something that really goes to kind of hierarchy of the data as well. When you have information from your, integrated eligibility system, say, your SNAP system, as well as information on that same child coming from your education agency there, and you're, pulling everything together and deduplicating and making sure that everything's, you're using the most up-to-date data. You have to look at your data hierarchy. So, as Cynthia mentioned, foster care, really the information there kind of trumped everything else because it needed to go to, a particular location so that the caseworkers could make sure that it arrived wherever the child was placed at the time of issuance. And then the data from their eligibility system, and then from the education agency, then the data that came from DP, Department of Public Instruction as well. So that's really important to think all the way through. And there are, North Carolina has, really brilliant data minds who spent a lot of time on this as well. And frankly, there's plenty of data cleanup efforts that happen through this over time too. But that's definitely something to spend time on and thinking through even some of those edge cases, like, okay, well, what if we have someone, who indicates that they don't have a permanent address? What can we do there? And one of the really neat things that North Carolina has been able to do is electronic communications. So they, if they maybe don't have a perfect address, but so they have to send the card to a certain location, but say there's a good phone number, they can actually message that person and let them know that they've been issued a benefit and where to be able to pick it up. So really the e-coms that North Carolina was able to start using this year have been really beneficial because it really helps with some of those edge cases, also helps to be really flexible and agile as, we're finding some things. They can really communicate directly with those families. So that's something that I would want to point out as well, is that can be really useful in that time.
Great, you guys. Well, that's excellent. We got a lot of questions coming in, so we're going to kind of pick them off as we go. I just wanted to clarify one thing Cynthia was talking about the funding, because you did get creative in that you used philanthropy, you found money at the governor's office. It's kind of found money exercise going on. And it seems like that happened because, the way you have to plan for the governor's recommended budget every year. And if anyone on this call is looking to implement this, I think it's so critical to communicate to your stakeholders, your legislators, your funders, everybody, about getting that rec in, so that, to Cynthia's point, then the federal government can match your state's general fund dollars. So I think what Cynthia ran into was, well, there was no pre-planned budget for state dollars to get matched with federal dollars. So unlike during the pandemic, when it was fully federally funded, now it's like, hey, you give $1, we give $1, but that wasn't there. So I think that's a good one to call out. And then some of the politics too. I mean, let's face it, politics are a part of everything. And Cynthia talked about their governor was super on board and was a champion of this. So, you know, naturally you have to communicate these messages well to your politicals in your particular jurisdiction and see where they lay on these things and make them understand how it works. But so back to the comms outreach efforts. So somebody asked, I mean, you've mentioned comms as a difficulty. Somebody asked in the Q&A, what type of comms outreaches did you do? Like what types of vehicles? So I would say, I mean, there's certain vehicles communicating with your governor's office and maybe your legislators or those kind of key government leaders, stakeholders, but then the schools and then the actual parents and families and children. I mean, so maybe step us through some of the venues or vehicles you use to try to get out the message the best way you could.
Cynthia, do you want me to, or you want to?
You want to get started and then I'll jump in.
Oh, sure, fine. Okay, happy to. So we mentioned the different stakeholder groups, and so we we created webinars and sort of tailored them to each group. So to give a couple of examples, obviously there were groups within DHHS that we needed to prepare for this program as well. So we, including those, foster care caseworkers. And so we would have specific webinars and invite lots of, everyone to come. And we would tailor to the information to the group that we were presenting to. And especially we would say, what that particular group needed to take action on. So within DHHS itself, also within the education community, we had webinars specific to them. And then, well, even Greg, you mentioned, the philanthropy, providing information that North Carolina could take and use to go and seek those funds as well. We also, of course, you have your regular program communications that you must do, with the participants themselves. But a couple of interesting points for that is some of the, say, for invitations to apply. One of the confusing points of confusion with any new program, I'm sure, but particularly with this one was who needed to apply and who was automatically eligible. We knew the majority would be automatically eligible, but there was a large group that might need to apply as well. So actually having the information to be able to communicate directly with those families, to educate them, but also to provide them an invitation to apply if it looked like they might be a group that could potentially be eligible if they did apply. We also, we did quite a lot of kind of leadership briefings. Other North Carolina has, sort of regular meetings that they have with, say, their county offices, and so we would prepare things for them to address those as well. There's internal documents that they use on, policy and sharing information with their county offices, and so we would work on pulling that information together. So we tied into some of North Carolina's kind of standard ways of communicating internally with their group, and we just, provided the information for that. And then, just some new, interesting, really I have to say again, the e-coms, the text messaging, the emails was a really great way to communicate with people that allowed the state to provide the information, the communication to people in methods that they are used to receiving information nowadays. And it was quick. It was very flexible. Those, I have to say, that was one of the really most wonderful things that we were able to, that North Carolina was able to do for this program, because the program moved so very, very quickly and you had to get out so much information. That was a really helpful one.
Yeah.
And I wanted to just add to that, Leah. Yeah, you are so right. The e-coms were, very, 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 very instrumental. And I did want to just highlight that in our notice of eligibility. So the notice of eligibility went to everyone who was part of that CEP group, who were eligible based on direct, or what we call the streamline group, that actually provide that. But it also gave them an option to opt in or opt out. So we kind of covered a couple of things there. So we sent out those, and then they can opt in and opt out. In addition, we also, to the text message and email, we use robocalls too. And this is basically kind of giving kind of a voiceover of what the program is about and what their next steps are doing. But we found all of them to be quite effective. And we knew that because after each time we sent out all of these kind of e-messages or e-coms, all of our call centers really had an uptick. So we knew that it really was very effective.
Great job. Well, so, and
another point too, Greg's. Oh, go ahead.
No, go ahead.
I was gonna say one more point on that too, just to give an example of how that the flexibility of and quickness of these e-coms is really helpful. And also of being constant. I mean, this is a new program. You have to be constantly watchful, constantly looking at the data, always mindful and looking to troubleshoot anything that might come up. So, as it was coming to be near the time where, folks' benefits were starting to expire and expunge, we actually started looking to see, how many people had never even, used a single benefit or activated their card. And it was a large number. And so we were able to communicate with them directly, through electronic communications and say, look, make sure you activate your card and use your benefits, because we had seen that there was this large group that never had, and whether or not they had missed that it existed, or were worried that maybe it wasn't real when it came to them, or just thought it was something else when the card came in the mail, whatever it may be. That was one other way that we could very, very quickly and for very cost-effective way get it out to them. That's just a concrete example there.
Great. Well, no, thank you for that. So we still have some more questions, but I promise we're going to get to those. So those in the audience that ask those, we're going to get to those. But you mentioned some visuals maybe that could walk maybe the audience through a few things that might be of interest. So Cynthia, did you want to share some visuals and point out a few things?
I just think maybe, yes, let's just start with the first slide. I think it would just be helpful just to kind of see the state of North Carolina and kind of some of the metrics we use to make it, that helped us decide that we're going to operate it. So of course we talked about, the need. I mean, 1 in 4 children and 60% that are 1 in 4 children that are in food insecurity or chronic hunger. Then we have the 60% on free and reduced, but 12.8% of North Carolina residents live under poverty. And then we actually looked at some of the causes. And of course, one of the things that was very clear to me, being a summer nutrition manager in the past, is that we never seem to have filled the gap with summer meals during the summer like we do in the school system, where we have a captive audience. So this is kind of one of those things that helped us. And then just knowing that, lots of people didn't have access to grocery stores or, affordable grocery stores or supermarkets. And then that fewer than, coming back to that summer nutrition, fewer than 20% of those students that are eligible were receiving meals. But we also know the impact of hunger over 3 months. You know, many times kids return to school, just as Greg mentioned, they return to school and there's just, you know, first of all, they had the summer slide, but then there's also other emotional and physical effects. But the lack of nutrition during the summer affects the children's health, and it also adverse childhood development outcomes, whether it might heighten or worsen during this time. And let's just go to the next slide. That's just kind of to give you the overview, and then just to highlight that we serve nearly 1.1 million children. And again,
Cynthia,
that's a significant number.
Can I ask you about that one slide? Because there was a question in the audience.
Okay.
About,
Let's go back to that slide, please.
That's okay. So the 1.1 million children, the person in the audience asked, did you actually get benefits out that summer? You know, so I think that's the $1 million question here. So you guys did, clearly. I mean, a lot of benefits.
Now we are still doing issuing benefits, just because we're still trying to address a backlog in our federally funded programs.
Okay.
But our last issuance was in October the 28th. And as of October 28th, we did get out 1.1 million benefits to a tune of about 130,000. So yes, 30 million. We did definitely get it out. We started our first issuance in June, and then we just continued our process. We've been pretty much doing it on a cadence of about every 2 weeks. We did have a longer interim in there when Hurricane Helene hit, because we wanted to hold and send e-coms to make sure we had the correct address to send the benefits. But yeah, this is as of October 28th.
Great.
Right, that was another great concrete example of use of those e-coms. We recognize that with Hurricane Helene affecting a quarter of the counties in North Carolina, and many people having to move locations, that if we did the issuance and sent out the cards, they may not be at that location anymore. And of course, some locations didn't exist anymore, and many roads didn't exist anymore. So for that period of time, we were able to send out the e-communications, and people could report back what their current address was, so that we made sure that we were able to issue the benefit to them to the correct address. And yes, Cynthia is correct. I believe our first issuance was June 15th, and other than that hiatus for Hurricane Helene, very, very regular benefits every 2 weeks. And just kind of most issuances were out by the end of the summer operating period, and then just into September, and then really just some of the cleanup right now of the backlog of program, processing SNAP and TANF, things like that. Yeah. So
Right.
So let's see that other slide, Cynthia. We got 12 minutes left with these folks, so let's show that and check.
And I think this other slide would really help give a visual to kind of the massive work that has to go into communications. So, generally you saw all the things, there's a list of all the stakeholder materials that we put together. And then we had the public, all the different things we did in the public. But I wanted to just kind of highlight, Leah mentioned this, and she talked about the webinars that we put together, but we did 10 webinars over maybe a month or two time period. And it was different stakeholders, each one of them really addressing a specific part of the program, how it relates to different stakeholders. And so you can see down at the bottom of our attendees, we really did do a huge impact and had a lot of people attending those. But, we then had the social medias engagements. We had the webpage, and these metrics that are here are as of June of 2024. we're sure that these are much higher now, but just wanted to give you kind of an idea and look at, you know, you can definitely tell from here, it's not a one and done thing. It is a continuous process. And even when you feel like you have a plan and you know what you're going to do, just be flexible enough to know that you have to respond to whatever is going on at that time. For example, what we just had to do with holding the issuance to make sure that we had a good idea of where people were, where they were stationed, so that we can send them their benefit rather than sending it to a location where, they were not going to be there.
Right. Okay. Well, so there's a few other things. So how about training? A couple people asked about training. I guess for you, Cynthia, getting on the education side and your organization side, how much went into that? And somebody even asked if you had any artifacts to share, like things that were created to help people train. So I guess I'll say this, and maybe I'll get word from the people in charge here that are running this on the side, is when somebody asks an anonymous question, it might be harder to reach out to them offline and get them to the answers. So if you are putting questions in the live Q&A, it's okay to be anonymous, but if you might want to get more granular with folks and get the answers, we can hook you up and get you all those answers, because there's things in there about appeals, and there's very detailed questions about people that really want to get down to the business of doing this. So we do want to answer everybody's question, but some of them I think are a little bit more detailed and require that. So how about the training side, Cynthia? Anything there?
Well, I'll talk about training, but I will just say that, North Carolina is very willing to share whatever we have. And I am definitely one that do not like to reinvent the wheel. So if there is any piece or any particular items or that anyone would like, feel free to reach out to me. We are very willing to share. So training, I think we used our webinars as a huge part of training, because we had to train all of those stakeholders so that they would know how to conversate with the recipients or other peers. But as far as our staff, we did it during staff meetings. It was continuous. I would call it like continuous quality improvement. It's like this continuous training process, because part of this training was we were learning as we were training. So we had to train, then we had to retrain, and we had to make sure that we would bring people up to the next level as we are receiving additional guidance from USDA. We had to retrain. But we did a lot of those webinars. We made them available and like as a recording for people to go back and re-review. And I think I would say that we're still training today.
It never ends, does it?
Yes, it never ends.
All right.
And just to add to that too, some of the brass tacks of, training for the program itself, EY supports North Carolina in summer EBT call center. So we created training materials for, call handling and all of that, specifics on the program for that aspect. And then we also support North Carolina in, we provide, well, of course, many of the applications are able to be, it's supported by a system. So many of the applications are able to be, automatically assessed by the system itself. If any of them are kicked out for some sort of manual review or something like that, we do support North Carolina in reviewing those applications as well. So we created and provided training for our customer service representatives in that aspect too. So kind of the brass tacks of training for the program and operations themselves, itself there, that exists as well in terms of actually, a lot of the work that has to be done on the operations side.
Right, for sure. All right. Well, I think that, given Cynthia's willingness to share and pay it forward, I think that there's lots of information to really get down to some of the granular details about this that are coming through some of the Q&A. So, and when it comes to results, I mean, we like to end something on, okay, what were the results? And everybody wants to see something like that. But I know how hard it is to measure this, because it takes a while to really collect data to measure the effectiveness of something that hasn't been going on for very long. So there's some lag there. But then also, I think that the intangibles, the things you really can't measure, are just so apparent in this type of program. We saw the results of 1.1 million children receive support, which is obviously a great result to the work. But are there any other results that you would be looking forward to seeing, Cynthia, to really hold up as a return on a program like this?
Well, I think most of our metrics, again, was around how many children got the benefits, and then looking at the spend rate. So our spend rate, I believe the last time I looked, and it's been a minute now, the last time I looked at our spend rate, we were over 80%. And this is even with some of those who made it, hadn't pinned their cards yet and hadn't used any of their benefits. But as we began to reach out to them, that's what we began to see our spend rate go up even further. So the spend rate obviously shows that whomever got the benefit really, really needed it. I would also think that just having testimonials in our social media post of people really genuinely thanking us for giving them the benefit. So, we gave one benefit that was $120. Many people was like, what is $120 would do? But in essence, $120 for someone who has nothing is a lot of money.
Yeah, people have, I used to say it all the time to the great people working in Arizona. You'll never know the impact you make because you won't get that call. Some awful situation might not ever arrive. You'll never really know the true impact of the work. But okay, so we got 4 minutes left, and this is always the question of, well, what would you do differently? Would you do it all over again? And I don't know if 4 minutes will cover that, but if maybe each of you just take a little time and just say, worth it. Would do it all over again, but maybe just a little steer for anybody listening to do it a little bit differently.
Well, we're definitely going to do it. We're definitely going to do it for 2025. We're still not in the budget, and the leadership and everyone is all in for it. We are looking forward to putting that in there. I think we're going to use our lessons learned from 2024 to spearhead what we do for 2025. And so I feel like already our plan for 2025 is much tighter, and it will help us to really operate a much better program going forward. Leah?
Yeah, I think there's a couple of, yes, going forward into 2025, a couple other data points I think might be helpful that we did learn from this year for folks on the call is that even though we, conducted direct outreach and all of that, really less than 10% of those who could have applied actually did apply. So that is something that may be useful for those on the call as you're looking to plan for 2025. Another thing that was really helpful that I think North Carolina would like to carry into this upcoming year is the success of the e-coms, but not just for some of those like really flexible moments to react to something immediately, but also eligibility determinations, eligibility notices, being able to communicate with people that way was really a significant cost savings. I don't know, Cynthia, if you wanted to mention anything about that, but just the fact that was North Carolina was able to do that, and while trying to, find enough funds for this program was really, really helpful. And then also going into 2025, one thing is just, besides communicate with your EBT vendor. There are a lot of things that need to go, I don't know, Cynthia, if you want to address
Well,
this
I
part.
think one of the things is, we all got a shock last year with our EBT vendor and the costs associated with operating this program. And early on, we were told just use those same numbers for this year to do 2025. We just recently got another notice and the cost is very significantly higher. So we are going to need to go back in and do some adjustments. So make sure you understand and be flexible enough to know that the EBT vendors may change on their cost. So.
And everyone's going to be trying to issue at the same time. So make sure you get your estimates and speak with your EBT vendor as early, as you can, because early and often, because it's a seasonal program, right? I mean, everyone's going to be trying to, issue in a compressed period of time. So that's another point I'd mention.
Sage advice. And you guys, you did an amazing job. Thank you, APHSA, for putting this on. Thank you, everybody, for joining. Thank you, Cynthia and Leah, for sharing your great work and lessons learned. And I think everybody should really be on the lookout for what you guys did, both of you, and sharing the information and making this happen where you are living and helping. So thank you all for being here, and we'll see you another time.